All right, let's try this again. All right, we're gonna try this again and see if it works. I'm just waiting for Shari to log on. Okay, well, while we're waiting for Shari to log back on, and hopefully we can figure this out, why don't you guys start to give me a couple questions that you may have that you didn't send to me prior to this, and this way I can write them down now, and we can get to them after we ask the ones that were already sent. Oh, okay. Hang on. Hi, Jess.
What the heck?
We got it!
Yay!
Hi!
I don't know what's happening. I can't get it on my laptop, only on my phone.
Well, we can see and hear you very well.
Okay. Let me just, oh my goodness. Well,
Yes,
that
I
was
do, Jess.
that was a little scary.
That's okay. We got it. Sorry everyone for the technical difficulties, but we got it. So I'm super, super excited for this live because I have known you, ironically, for a long time, never put two and two together. And I'm very excited to have you on here. So let me introduce you formally, and then we'll get into the questions that people had submitted ahead of time. And if we have time at the end, I'll take additional questions if people have them.
Awesome.
So, okay, I'm going to read your bio because I don't want to mess it up because it's really good. So, okay. So this is Shari Botwin. She is a licensed clinical social worker, and she has been counseling survivors of all types of eating disorders, trauma, and abuse for over 23 years in her Cherry Hill, New Jersey private practice. She has given commentary on a variety of international media outlets, including NBC Nightly News, MSNBC, CNN, Radio Europe, and CBS This Morning. Is that it? That's all?
I think so. I think so.
And her second book, Thriving After Trauma, is a compilation of patient stories and some about her own personal journey of a recovery from child abuse. And I have her book right here, which is amazing, and I highly recommend. And what I will do is leave a link on my page so that you can link directly to this and also to Shari's website has a ton more information of everything that she does because her bio doesn't do her justice. So, okay, so welcome.
Thank you. Thank you so much for having me.
Yes, I'm very excited. So
yes,
I think what I want to do first is just to kind of give an idea to the people that are logging on that maybe aren't aware of what we're talking about. Shari specializes in post-traumatic stress disorder of all kinds. And one of the things that I want to make sure that everybody knows ahead of time is that post-traumatic stress disorder does not necessarily mean that the trauma had to happen directly to you. And I find that a lot of times people don't know that. And so they go throughout their lives not realizing that they very well may have a post-traumatic stress response because they just assume since it didn't happen directly to them, they can't possibly have PTSD. And that is not the case. It could be hearing the details of a traumatic event. It could be witnessing something that happened to somebody else but didn't directly happen to you. Anything from natural disasters, car accidents that you witnessed or you heard about, close family, friends, or family members. So I just wanted to make sure that everybody is aware of that before we get started. So Shari, I'm going to start with the questions that people sent to me, and I'm just going to kind of hand it over to you, and I'll chime in as needed, but I'm just going to kind of let you run with this. So one of the first questions that I got, and a couple people actually had asked this as well, what is the best way to go about finding a therapist who is somebody that they can trust, that they can talk about some really difficult issues with, and how do you recommend going about doing that?
I think finding a good therapist or finding a therapist that is the right fit for you is actually one of the most important things that you can do when people are dealing with trauma or have a history of going through different events that they haven't processed. I think it's really important that they find somebody that has dealt with trauma. There's not a degree when we go to school to be therapists, there's not a degree, a trauma informed therapist. Maybe that will change as we go through the next several years. So it's really important that when you're looking for a therapist, read about the person, see what kinds of experiences that they've dealt with or helped other people with. That's the first step. But the second step, I think, is when you find somebody that you think, oh, this person I think would be really good, I think this would be a good fit, call that person and say, can I talk to you for a few minutes? Can we just have like a 5, 10, 15-minute phone call so I can get a little bit more acquainted with who you are and what your background is? I think that we usually can, you get like a gut feeling when you talk to somebody. And I think when you read a website, you don't really know what you're walking into. So that's the second step. The third step, I think, is to request, if you find somebody, you've talked to them and you think, I feel like I could open up to this person, just set up an appointment to go in and meet with the person. In your mind, the way I say it is, it's like a consult, a first visit. And this is the visit that's going to help me to decide if I want to actually do therapy with this person.
Mm-hmm.
So I think you have to take it in steps. And what I would say to people is, don't get discouraged. If you meet a couple therapists and you're thinking there's no way I would want to work with this person, it's frustrating, but don't give up. You will find somebody that you connect to and it will work out, but you have to really go with your gut. And you really want to make sure this is somebody that has dealt with trauma. Trauma is a very, as we know, it's a very difficult thing to go through, and it's a scary thing to say to yourself, I really want to talk about things that I've been through. I want to talk about things that I've seen other people go through. It's not like I'm going to go in and talk
Not
about
easy
things.
work.
No.
No.
And it's,
Yeah.
yeah.
And I tell people too, sorry, I'm going to adjust my phone. I tell people often that, if you leave my office feeling less uncomfortable than when you came in, I didn't do my job. Mm-hmm. And the reason why that's so important is that I think that going into therapy, especially for trauma, it's important to know that it is not supposed to be easy, because what you went through was not easy. Therefore, your journey through, recovering and moving forward in life is not going to be easy. And to have a therapist that you can trust, that you feel comfortable with, that you don't feel judged, because I know there's a lot of shame, guilt, embarrassment that goes along with a lot of post-traumatic stress. It's important to not feel judged, even if the therapist is not judging you, but you perceive it as such. It's really important, I think, what you said, to pay attention to your gut. Two questions for you. One is because I know a lot of times, particularly with sexual abuse, people's perceptions and their trust of others is a little bit skewed, and they don't always trust their intuition, because their intuition throughout life has in a way, I don't want to say failed them, but kind of steered them wrong. Not their fault, obviously, but took them in a different direction. And how do you help people differentiate between whether or not they're connecting with this therapist because it's part of an unhealthy pattern and that's why they're familiar and comfortable, versus this is somebody that can help me with this?
That's really tricky, because I think when you talk about the trust that gets taken when we go through these kind of experiences. And then when you have a reaction to somebody that you maybe just met or met a couple months ago, it's really hard to differentiate. I think it's really important that you bring that up in the session, that you talk about it with the therapist. But I also think it's important to step away and try to think about for yourself the feelings that I'm having or the reaction that I'm having to this person. Is this something that is about what's happening in the room with that person? Or is it feeling familiar, and is it something that I remember feeling in the past?
Yeah.
That's one of the most difficult things
Yeah.
about trauma, is how do you figure out what's about today, what's about the past? And
Yep.
sometimes it's both. It can be both at the same
Correct.
time.
That's right. Yeah. And that, I think
Yeah.
that in the work that I've done, and I'm sure for you too, is one of the hardest things I think for patients to feel
Yeah.
comfortable with is being able to trust their perception of
Yeah.
situations, trust their own emotions and their thoughts about things. The other thing I wanted to ask you, which you had mentioned, and I know we were going to get to this later, but since you mentioned it, can you discuss what trauma-informed means and why that's such an important term to understand?
That is a word that I feel like I've heard 50,000 times in the last 4 months. I feel like I talk about it with doctors, with therapists, with attorneys. When I think of the word trauma informed, I think of going to somebody or working with somebody that has taken classes or gone through trauma or gone through different types of training to understand. Like, for example, when you talk about the shame, people who aren't trauma informed don't really even know what that word
Right.
means. They think shame and ashamed are the same.
Correct.
They're
They're
not
not.
the same. So I think it's really about finding out, is this somebody that has been exposed, whether they themselves have been through trauma or they help other people. When I think of patients through the years who try to seek legal help, I'll never forget this. One of my patients, the person that was representing her said to her, she was in a court hearing, or she was trying to find justice, really. The guy that she was dating, the boyfriend that she was living with, was physically and sexually abusive. And right before they went into trial, he said to her, her lawyer said to her, well, why did you stay with him? Why would you stay with him? Right, like before she was about to go into court and
Yeah.
face this guy. So I think it's a broad word. It means something different to everybody. And I think in some ways the word is used too frequently. To say you're trauma informed, I need to know more about what that actually means. So that's the other thing I want to say. If somebody says, well, I'm a trauma expert or I'm trauma informed, that's not enough information. I want to know, have you represented other people who've been sexually assaulted? Have you worked with other patients? I know when I was looking for doctors early in my recovery, I wouldn't work with a doctor if they didn't understand sexual abuse. I would call, I would meet with doctors, and if I felt like this person does not understand, or I'm not going to feel safe in this room, then I'm not going to meet that person. I'm going to keep moving forward and finding somebody else that I feel I can feel safe with.
And I think that's important to note because, you know, a lot of times, particularly with sexual abuse, to be able to advocate for yourself is such a
So
difficult thing
important.
to do, because had you done that in the past but people didn't listen to you or they didn't believe you, you know, you internalize this message early on that it's almost not worth advocating for yourself. And I think it's very important for people to understand that, exactly like you said, you want to make sure that you ask the right questions, that you ask what trauma informed means to them. What have they done? What have they experienced personally, or family members? Who have they represented before? How many patients have they? I've had people flat out ask me, how many patients have you seen with PTSD? You know, how many patients have you seen with generalized anxiety disorder? Because they want to make sure you're qualified. And I worry sometimes that people who have been taught to not advocate for themselves don't ask the proper questions, and then therefore don't get the proper help, because particularly with PTSD, it's probably one of the most dangerous diagnoses to not treat properly.
Yeah.
right? Because, you know,
Absolutely.
there's so much complexity, and if you don't handle it properly and you don't know how to treat it, you really can do somebody harm.
Mm-hmm.
So I think it's super important, like you said.
Yeah, yeah.
So another question that I got was, which I thought was interesting, and I did respond back to them very briefly, just with my 2 cents on this. But the question was, how can I calm myself when I'm hurting constantly over what I've been through? How do I handle this, or do I just stop remembering? And so the only thing that I will contribute,
Yeah.
the only thing that I'll contribute that I did send back to them initially was, you know, to stop remembering also simultaneously invalidates your experiences, and it changes who you are to a certain extent. And it's important to realize that, to stop remembering it's part of who you've kind of come to be, and that stopping the thought and stopping such a traumatic experience actually makes it louder. You know, trying to push it away and not think about it, makes it scarier and bigger and more of a mountain to climb. So if you could talk a little bit about some strategies that people can use in the moment. And I'm also reminding everyone that this is not for, you know, personal therapy, as much as we would love to do that. These are just kind of some general ideas, general strategies that people can use in the moment.
I know when we were planning to do this, we were talking a little bit about some of the questions, and I think this is one of the questions that struck me, really had me thinking. I think it's a huge theme for people who've been through anything. It's not even something that's just traumatic. Any type of painful experience or loss or change. And I think as humans, we find ourselves wanting to forget about it.
Correct.
Why do I have to remember this? Can I just like move on, or can I get over this? So one of the things I say to people is, when you're remembering stuff, one of the first things you want to think about is, why now? Why now am I remembering this? What's going on in my life today that makes me on some level need to know or revisit this experience? And then what I try to say to people is, if you allow yourself to know and remember, then you can more move into a place of healing. When I'm working, and this is where PTSD can be very scary, when I'm working with people who are having flashbacks or memories, when they don't want to remember, they start dissociating, they
Yes.
start going into what I
Can
would.
you explain that process a little
Yeah.
bit about flashbacks, dissociation? And because I think oftentimes dissociation is not understood fully, and people automatically assume multiple personality disorder and kind of glorify Hollywood, you know, and that's not what we're talking about. So can you talk a little bit about dissociation and flashbacks, and, you know, as it pertains to coping skills and what that looks like?
So what happens for people is, when we go through something that is sort of mind-boggling or overwhelming, we have this human instinct to survive. So what happens is our brain, and this is very common for people who've had histories earlier in life, when you're younger and you don't have all the words and you don't understand, what happens is that you find ways in the experience to leave. So the example that a lot of people may hear about is, they feel like they're watching something be done to them, or they feel like they're sort of on the ceiling looking down, thinking, who's that person that just happened to? That wasn't me. So this becomes the key to survival. And for somebody who's in more of a long-term abusive situation, again, especially as a kid or young adult, the longer you're in trauma, the more used to dissociating you become. So it's almost like it's an automatic thing, and it's not conscious. It's not like people say to themselves, well, I'm going to just figure out how to like get on my ceiling right now. It's an unconscious
Yeah,
instinct.
it's neurological. It
Right,
just it,
right.
it's probably, I mean, it's almost like a life or death coping skill, and your amygdala just it, you know, turns on, and you just, it happens. It's an auto, like you said, an automatic response.
And I
It's
think,
survival.
I really think, and I try to say this to people who feel shame about having dissociation in there, as part of their symptoms, I say, you know what, but that might have been what kept you alive.
That's right.
The
That's
trick,
exactly.
here's the trick. The trick is, as you're going through your recovery and you're trying to develop coping strategies to stay present, you have to get to a point where you realize, I don't need to dissociate anymore to stay safe. In fact, if I continue to dissociate, I'm going to find myself making choices that will probably re-trigger
Yes.
or re-traumatize. But it's not something, again, that I say to a patient and then they walk out and they're like, oh yeah, I learned this really cool thing today from Shari.
Yeah.
It's a process. It's part of recovery. Just like when somebody comes to me with an eating disorder and they're trying to let go of those symptoms, this is not something that we just let go of. It's something that you have to become aware of in your own self. So as a therapist, it's partly my job to try to help people become aware when they start to dissociate, and people will figure that out. It's not that they're becoming different people,
Right.
or like you said, the multiple personality is an aspect of it, but
Yeah.
for most people, it's about leaving the experience. So if I'm driving my little guy to school and I get home and I think, I have no idea how I got him to
Stress.
school, that would be an example of me during those 10 minutes just losing time. So I think what you want to do is you want to really, when you're in that remembering and that the flashbacks, you're not fully present. You're definitely not, because when you're having flashbacks, you're not recovering and healing. You're remembering because there's a part of you that's saying, these are experiences that I've been through that I need to heal from and that I need to grieve. So when this person was saying about the remembering thing, I I mean, I get it. I used to say to my therapist all the time, it would have been so much better if I didn't remember all this. Why did I have to? I don't want to know this. And I would try at times to disconnect and just say, you know what, I'm probably just making this all up. I'm not. This is so stupid. And
Yeah.
then, like, within hours, I was suicidal. And I felt like my entire life was a waste. And then I would think to myself, but you don't feel that way when you're grieving. You feel
Right.
that way when you don't want to know, because then you start. A lot of times, what happens is when you go into not wanting to know, you get flooded.
That's right.
Because your brain says, well, guess what? You need to know this stuff. I'm giving you the heads up, and it's going to keep
It's
showing up.
happening whether you like it or not, kind of thing.
Yeah.
Right.
You don't really have full control. And I always say to people, I really do believe this. Our minds are so powerful.
Oh yeah.
When I meet somebody and they start unraveling in these memories, I say to them, there's a reason why this is happening now. And you know what? It wouldn't be happening if you couldn't handle it.
Right.
It just wouldn't be. And there's things that will
Yeah.
trigger the memories. They don't, it's not like just one day I just started
That's right.
remembering stuff. But if you
It
weren't
needs something
ready,
to be pulled out. You need to, there's something has to happen, which brings it back to your original point, which was, why am I having this right now? Because there's always a trigger. It doesn't have to be something in your environment. It could be a physical sensation. It
be
could be
anything.
smell. It could be anything. Um, and one of the things that even aside from PTSD that I work on so often with patients is the idea that what worked for you growing up as a child
Right.
was resiliency on your part because you had to figure out a way to survive.
Mm-hmm.
And it was pure survival mode, and it worked for you because we don't do anything unless it works for us or we get something from it. Even if we know
Right.
it's unhealthy, we don't do it unless we get something from it. So those strategies worked for you. Now, fast forward 20, 30 years into adulthood, and you're having difficulty in your relationships, you're having difficulty at work, you can't figure out why. A lot of the times it's the person understandably using those same skill sets and strategies when the situation that they're in is completely different than the situation they were in when these skills developed. And so they have to, one, be aware of those patterns, and two, be comfortable with being uncomfortable, letting those patterns go, because that's what has kept them alive for so long.
And you know what I think too, and I didn't realize this at first in my own recovery, but after you go through really difficult things, you go into a state of just trying to sort of survive and get through the day.
Yes.
But a lot of people ask me, what do you mean by thriving after trauma? What does that actually mean? Well, in order to actually live a full life and have the things that I want, I need to face what happened and understand the impact, or I'm going to spend the rest of my life avoiding anything and everything. I used to do anything I could to avoid being triggered.
Yeah.
And I see it happening all the time with people I work with. And I think I get why you're doing that. And I mean, part of me wants to say keep doing that, but then
Yeah.
I think, but you know what? But how are you going to go and have kids or get married if you continue to feel like, well, there's no way I could be a parent after what happened to me? I would never be able to be somebody else's parent. And I think to myself, yeah, that's understandable that you feel that way, but it's not really true. I mean, just because we come from whatever environment we come from, that's not all of who we are. And that's
Right.
what I try to say to people. Part of recovering from dissociation, the word I think of is integrating.
Yes.
It's not about disowning the dissociative part of you. It's about integrating and understanding that if I feel like I'm dissociating right now, there's something going on here that's not okay. And I use it as like sort of like the warning sign.
It's information.
Yeah.
It's information, you
Yep.
know. And also, you know, the brain of somebody who has had some sort of trauma,
Mm-hmm.
unfortunately, is always in kind of hypervigilant mode. So, you know, you're going to naturally be triggered easier by things that maybe, let's say, somebody with anxiety and depression, or a different type of anxiety disorder and depression, may not be as easily triggered by, because you know, that hypervigilance and that hyper awareness is there, it's present, and it just makes people, in my experience working with people, it makes them very much more aware. And that's why understanding what's going on right at this very moment is so critical, because it gives them a sense of control.
Right.
You know,
Right.
association, it's a scary situation. It's scary for them to go through.
Right.
So to help ground them in the moment by really focusing on their environment to figure out what exactly it was. So this kind of leads me into one of the other questions I got. When we talk about triggers, it could be anything. That could be physical. It could be your heart racing or anything like that. And I wanted to talk to you also about your cancer scare and kind of how that impacted your triggers. So a couple people asked me, and I'm so happy people ask this, because I talk about this all the time and it's so important. The connection between PTSD and autoimmune diseases, or you know, those types of diagnoses that doctors kind of use as that kind of, I don't know what it is. It's you know, it's in our head, or it's just we can't figure out a reason for it, and they kind of miss the mark when it comes to maybe what's causing it. So if you could speak a little bit to how physically your body can feel PTSD versus just your emotions in your mind.
I think really for a lot of people who've been through things like cancer, war, serious illness, abuse, if you think about our bodies, they're really our containers for not just the physical experience of being through trauma, but the emotional experience. And I think what happens is that we store all those, not just the memories, but the shame, the fear, the anger, the sadness. These are things that people will try to push away psychologically, but in our bodies, that's where we're holding it. So I think what can happen for people, like for example, a lot of people talk about having chronic back pain, migraines, different types of autoimmune issues, and it's not that we don't cause those things to happen, but I think what happens is that if we're living in a life where we're trying to contain, but really we're repressing pain psychologically, or we're trying to push away experiences that don't feel digestible, ultimately they're going
I
to come
love that. I
out.
like that. Not to cut you off, but I like that. Things that aren't digestible. I love that.
That when I think of trauma, that's what I think. I think
I love that.
like as soon as you just said that too, I was thinking of when we were all seeing that video of George Floyd. And the first time I saw it, I remember just sort of, I was actually back here, just sort of staring at the TV thinking that that's not actually really happening. That can't
Right.
be happening.
Correct.
And then you get hit with the feelings. And one of the first thoughts I had it was, how is this family or anybody that's been through something like that, when you see those images, how are you supposed to digest that? How do you process that?
Right.
How do you process things that are inhumane,
Right.
unimaginable? And I think, again, that for people who've been through trauma, a lot of us have been through experiences that just don't make any sense. And it's
That's
not
right.
even just the actual abuse that I lived through, or when I talked to this one guy who watched his best friend get killed in Afghanistan. It's not just the actual experience, it's all the emotions that come with that. And how do you keep living your life? How do you feel okay about having a good life, or having happy things happen to you when horrible things have happened to you? Or how do you believe that people are good when the people that are raising you are the people that are hurting you the most? So I think all these different things that we've been through, if we're not really dealing with them, and I don't mean just talking about them in therapy, I mean really like working through them, meditation, yoga, writing, painting, whatever your outlets are. If we don't have all those things going on, it's gonna come out in some way. It's gonna come out. And when I was dealing with my cancer stuff, I don't think what happened to me is what caused me to get cancer. But when I got diagnosed with thyroid cancer in 2005, I thought that the reason I had cancer was because I spoke. As soon as I found out what the surgery was going to entail and that they were going to have to do an incision in the front of my neck, I sat in therapy and said to my therapist, the reason that I got this cancer is because I said something about what happened to me. And I went into the surgery feeling like that, feeling like if you hadn't opened your mouth, you probably wouldn't be lying on this table. Now, like 15 years later, I just recently that there was like a nodule that was found in December. They thought that I had a reoccurrence. The difference was that when I found this out, I was crying, I was scared, but not because I thought it was my fault or that I made myself have cancer, but I don't want to be sick. I
Right.
don't want anything bad to happen to me. I used to feel like that's what should happen.
That happened.
Now I'm thinking I have a almost 9-year-old kid that I have to go pick up at the bus stop, and how can this happen? So what I focused on as I went back for the testing and the ultrasound was what was different. What's different now is you're lying on this ultrasound table in 2020 during this ridiculous time in life when I couldn't even see the tech. She was so covered up in PPE, and it was such a strange experience. But what I did when I laid on that table was I compared how I was different, that I don't want to be sick, that I don't feel like I'm the cause of this, that I'm sad that I have to revisit this time in my life. I don't want to have to think I have cancer again. And I had flashbacks and I felt scared and I felt stranded, but I just kept saying to myself, think about what's different. Think about all the work you've done. Think about how you felt when you were diagnosed to how you feel now. So different. So rather than get really like depressed about it and go into like shame, I embrace it as, I guess this is another opportunity for me to work through another aspect of my history. And that's kind of how I approach the work.
Yeah, I think that when you said that you thought it was because you spoke, it's almost like you brought it on yourself. It was some sort of either a punishment, or because it became real, somehow something bad happened as a result. Um, that is something that we see a lot. Hi, Dr. Lockhart. That is something that we see a lot across many diagnoses. Is this concept of magical thinking,
Yeah.
where
Yeah.
you make these associations between one thing and another thing that, in that moment, to you seems like it makes sense, but rationally they're not correlated in the least bit. Definitely not causative. And so it's right. OCD, exactly. It's just like OCD, where you create the cycle for yourself as a need to feel some sort of control. I'm
Yep.
sure for you, it was, and I obviously don't want to speak for you, but it was some way to make sense of another really scary situation. And that was your go-to link because that's what you had as a comparison. And it makes sense. But I think what's important, what people listening, what I would love for them to understand is that irrational thinking, it does stop. It can stop, and you can formulate more rational minded thoughts in the moment. but it still is going to be work. Your knee-jerk emotional reaction may always be to connect it to the abuse, may always be to connect it to those emotions. And that's okay. It's being able to acknowledge that you're doing it and redirecting yourself, like you did on the table, and being able to say, okay, what's different in this moment, and having that awareness, I think is super important.
And, I find, because everybody struggles with this stuff, I find that there's no such thing as talking too much or writing too much. Like, when you go to therapy and you work on this stuff, don't just work on it in the session. Like, right? Like, a lot of times what I've done with people is I try to get their own voice to be what they've heard me say. So it's sort of like the DBT, CBT strategies that we talk about. Like, I will say to people, can you talk back to that younger part of you, or what does this remind you of, or how can you reframe? Because I think the problem with trauma is that we are left, we struggle. And when I say we, I'm talking about myself and people that have been through trauma. We struggle to really see things clearly because there's a big mess in front of us. Every time we're hit with a challenge, even the quarantine, people who are having PTSD are talking about the social isolation as feeling the same as when they were abandoned or when they were locked up in their bedroom by their abuser. And it breaks my heart. In the beginning, it made me so upset because I think this is awful. Like, I don't want this for people. But as we're in these circumstances longer and I understand better for myself how I'm reacting, it's easier for me to say to other people, listen, I totally understand why you think that, but let's talk about what's different. When you get home to your house, how is it different? Tell me what's safe about it. Like, you're not living with that person anymore, or you're not that little kid anymore who's stranded. Just because they tell us we have to stay home does not mean that we can't ask for help. If I need to go get help, I might not be able to go into the office, but I'm going to pick up the phone. And that's a huge thing that I really want to.
So well said.
Yeah.
So well said. When quarantine happened, I had, naturally and understandably so, a lot of my patients' anxiety went up, depression went up because of social isolation, anxiety about anything and everything. Everything was heightened, except my social anxiety disorder patients. They were very happy. They were fine. But my patients who had PTSD, OCD, depression, anxiety, other types of anxiety, had a really difficult time with it because, exactly like you said, it brings up these feelings that made sense then during the trauma.
Right.
But the difference is that, yes, it's an uncomfortable situation, but it's not the trauma. The trauma is not reoccurring. And your brain's not necessarily in the moment differentiating between a rapid heartbeat now and your rapid heartbeat that you had 30 years ago. Your brain's just interpreting rapid heartbeat. So your brain doesn't necessarily initially know that you're not in danger. And so that's why the dissociation happens. That's why the fight or flight mode goes into play. It takes a lot of awareness to be able to be mindful and present and notice what is exactly happening in that moment. And while it may feel similar, the situation is safe. The situation is not dangerous right now. Where it was a problem, and I think probably, I'm sure you had this thought, I know Dr. Lockhart, we talked about this. My first thought when this hit, when quarantine happened, wasn't, oh my God, what are we going to do? My first thought was, what's going to happen to, I guess anyone, but I was thinking women at the time, who are being abused at home?
Yeah.
What's going to happen to these children who are being abused by their families, and school would report it because they would see, but now they're not at school. And they actually said domestic violence and sexual abuse rates went up, but child abuse rates went down. And that's not because it stopped happening, it's because it stopped getting reported.
Right.
So that was my first thought. So if you can talk a little bit about how COVID played a role in, you know, and even now, how to kind of incorporate this now, what was so not even on our radar, this very real scenario that could happen again to people who have PTSD who are in these types of situations, and you know, maybe some practical strategies of how they can handle that.
I mean, one of the things I think that we need to do as citizens, as people who care about other people, is pay extra close attention now more than ever. When the one thing that I will say is, because we are home more, we can hear more of what's going on around us. So if you suspect that the kid across the street or the woman living next door to you or the person living above you, if you're hearing, if you're hearing fights that sound like there's physical danger, if you're hearing people screaming at each other, now more than ever, it is our responsibility to make a call. So that's the one thing I would say. I think now we need to step up and we really need to advocate, because these kids, for example, they don't have their teachers
That's
looking
right.
out for them. I mean, when you go on a Zoom call and you talk about what'd you do over the weekend, the teachers are not, they're not seeing the kids. They're
Right.
they're missing. As a therapist, I'm probably missing stuff. I could be sitting on a
Yep.
telehealth session and have no idea that I'm talking to somebody that's also being sexually assaulted
That's
at
right.
night.
That's right.
So there's, I feel like we really need to pay extra close attention. And I think what you need to think about is, if you think there's something wrong, if you feel like there's somebody in danger, it cannot hurt to make a call, report it. Just report it. Even if you're mistaken or you're wrong, make an anonymous
Yep.
report. Don't don't just sit there. So I think one of the things that I try to do where I live is, when I'm walking outside or I'm seeing kids or looking at neighbors, I just sort of keep my ear out. I
Yeah.
don't, you know, it's not my job to police the condo association, but I'm definitely more mindful now about what I hear.
Mhm.
And I remind myself, if that were me, if I were a kid who was being abused right now and somebody walked by my house and knew and didn't do anything,
Yep.
I won't, I refuse to be in that situation. So we can't go back and undo things that happen to us as when we're adults,
Yeah.
but we can certainly help somebody else. And if you've never been through anything like that, it doesn't matter. You still want to like feel like it's okay to make a call or make a report if you think somebody's in danger. And when you were saying about one of your first thoughts about COVID and the quarantine, I mean, I was talking to so many abuse survivors who were having flashbacks just because they were picturing their younger selves during COVID being totally stranded. And the good thing was, is it gave us an opportunity to help them work through things that happened to them earlier in life.
Yeah.
But the thing that was heartbreaking, it's like, here we go again. Here's another reminder.
Yes. And Dr. Lockhart had brought this up, and she always brings up excellent points. So I'm going to read hers. So what, and I think this is important for everyone to know, especially, you know, what's going on now in the world, you know, not just COVID, but police brutality, and, you know, the protests, just everything we're seeing on the news, and how, what are some strategies that you could recommend for people who are, let's say, having experienced racial trauma? You know, because I can't imagine with what's going on now that that's not increasing substantially. I mean, it was already there.
Now it's in there. It's like in their face.
So any
Yeah.
kind of strategies for types of trauma that are not sexual or physically abuse related, but more of a racial trauma, especially what's going on now.
I mean, I was just watching something about this before we went on air, and I think if you're in that situation, the most important thing to do is to know you're not alone and to try and reach out. I mean, right now, I think because we're basically home, the best thing to do is get online and look for online support groups, or look for different articles, things that you can read. And if you're somebody that has a voice and you want to use it, start your own group. I mean, I was listening to a woman earlier today talk about how she started a group in her town for racial injustice. And while it doesn't change her experiences, what it does is it empowers her and it empowers others to, now's the time to step up and use our voices, and don't do it alone. That's the thing I would say. I would say in any of these experiences, because I think when you go through things like racial injustice, you feel like you're the only one. And I think that's when you want to make sure you find other people to connect with. And what I say a lot is when we've been through things that just don't make any sense, or things that are just so not okay, one of the best things that we can do is not go back and retaliate, but like transform that rage and anger and turn it into action. Advocate, write to your local senators, start a fundraiser, start a nonprofit. There's so many things that we can do when we think about our voices and the different talents that we have and the different people that we know. If you know people that could
Right.
support you in starting an organization, now is a great time,
Yeah.
because we're all home sitting here trying to figure out what in the heck we're supposed to do all day. And
Yeah.
especially when you feel like you have so much going on inside of you, and you need to have outlets. And I think that's one of the things that with Black Lives Matter, it reminds me a little bit of hashtag Me Too, because I feel like finally people who've been through these experiences are actually having platforms. Like, they're being heard now more. There's more attention
Yes.
on the topic, and for way too long it's been sort of pushed away and ignored. So now's the time. Like, don't silence yourself. Do the opposite, and just keep trying to do things to remind yourself that you're not the only one, and that it's never too late. It's never ever too late to work towards change, which is something that I think I'm feeling now with Black Lives Matters. I think there's actually real changes happening. And while horrible things happened, something good will come out of this for the kids, our kids, or their kids.
Yeah.
You have
Yeah.
to make space for hope. You've got to, like, it's the same thing with COVID. It feels like we're going to be in this situation for the rest of our lives. I sometimes think like that, but you know what? It's not going to be like that for the rest of our lives. We're going to get through this, and we're going to fight to get our lives back to normal, even if it feels like it's going to take forever. And it's the same with all this other stuff. It's not going to
Do
be
you
like this.
find, do you find that people with PTSD have a harder time
Mhm.
adopting that mindset?
Yeah, I have one patient who says, she says to me all the time, "You are so annoying. Why are you so positive?" And I'm like, you know what? It is something that trauma survivors, PTSD people struggle with more, because part of PTSD is feeling hopeless, feeling like it's going to be like this for my entire life. And you know what? For some of us, it went on for a really long time. So I do think that people with trauma histories of all kinds, the guy that I was talking about earlier that lost his best friend in Afghanistan, he was never abused, or he didn't come from a crazy family. He watched his best friend get shot, and he at times 30 years later still feels like, I don't even know what the point is. What is even the point? So I would just say that I think that if you've been diagnosed with PTSD, one of the things it says is feelings of hopelessness, but it doesn't mean that you're going to feel that way forever. I always say to myself and to other people, we have to always make space for hope, even if it's tiny. Some days
I love that.
you gotta
Yeah.
like some days for me, my space for hope is like thinking about an image I saw with kids, doing their 6 feet away, visiting on their bikes, or listening to them talk on their phones.
Yeah.
um, Anything you can do to just stay in touch with hope, because you know what, we have to make space for that, or we're just going to sit in our houses and we're going to fall apart,
That's
and
right.
PTSD is going to consume you, and you're not going to be able to connect with people.
And I think too, this is behavior in me. I also look at that as, when you're holding space for hope, it also is a way to be more objective
Mm-hmm.
to your own emotions and your own thoughts at that time, because it kind of that space is that she's laughing at me. That space is that separation that you need to be able to be objective and kind of look at your thoughts and look at your feelings rather than it kind of all mushing together, like as you said, one big mess that's in front of you.
Yeah.
So I think we're good for another 15 minutes because we signed on late. So I'm going to keep going with some of these questions. So we did that one. So this one threw me. How do you deal with seeing the person who abused you on a pretty regular basis that, that caused you the trauma?
Yeah, that was one of the things that you share with me, and I thought, oh gosh.
Yeah, I know. I didn't
like
that. I know.
And you know what? I think it's a whole big process. So how do you deal with that? The first thing you think about is, how can I set up boundaries? How do I know? How do I protect myself in that situation? What are topics that I can discuss with this person? Most importantly, I think it's actually preparing for, what am I going to do before and after? Because
like almost like a game plan.
I think you have to, because I think when you're actually in contact with people that bring up your history, or people that have hurt you, again, like, you may really struggle to be fully present.
Yes.
And I don't necessarily think that's an all bad thing, but I think what you need to be able to do is think about, it's almost like building strength.
Yeah.
How do I build strength? How do I make sure that when I leave this contact, or I visit this person on Christmas, or sit in the backyard with this person, how do I ward off not going into a shame attack or not going into flashbacks? So I think.
Can you explain what a shame attack is for people?
Yeah, I sort of made that. I made that word.
I know what you mean, but I want to make sure that people kind of understand what that is.
I made that word up because when I used to have memories earlier on in my recovery, and it's not funny, but I'm laughing because I think, where in the heck did I get that word from? But it's sort of like when you just go into feeling like, I wish I weren't here anymore. What's the point? When you feel like your life is black, when you feel like you have this cloud following you and you lose sight of anything that makes you feel hopeful, that's a shame attack. So what you want to do is assume that if you're going to see somebody that was your abuser, or somebody that hurt somebody that you love, to prevent yourself from going into that spot, you want to make sure you have a plan. The plan is all about, again, about the boundaries. What am I going to do before? What are some things I can tell myself so that I can keep myself present and I can protect myself? What are my boundaries? How long can I spend with this person? In what context?
I think that's very important. And that can fluctuate.
Yeah.
That time you can spend with the person who hurt you or harmed you, that fluctuates over time as your coping skills get better. So somebody said an abuser does not respect boundaries. Correct. So
yes,
I want to just kind of really quickly give my 30-second speech on boundaries. Boundaries aren't for the other person. Boundaries are things that you set for yourself internally that are yours and yours alone. So if somebody doesn't respect your boundary, that's kind of that's separate from you. And you as an adult, or you in the situation that you're in now, you have the ability to either strengthen that boundary, to alter that boundary. Boundaries are completely yours. No one can take them from you. And they are supposed to fluctuate. They are supposed to change over time. They could change literally moment to moment.
Yeah.
So it's important to understand that even if someone doesn't respect your boundary, that doesn't mean that you're accepting that disrespect.
Right. It's like you find a way to react to the disrespect from the other person. And I'm so glad that you said that, because people often talk about feeling like their sense of safety and their right to be heard was taken. Sometimes the best revenge, honestly, for some people is, and this is not for everybody, but it's for some people, to be able to face your abuser. I don't mean face your abuser like go and say all this stuff. I mean, like, stare that person in the face and think to yourself, I will not let this person hurt me ever again. If this person says this or does this, this is how I'm going to react. This is what I'm going to do. And to be able to know that you can take that power back, that control back. I think
Right.
sometimes, while again, the question is, it's a loaded question, and there's a part of me that wants to say, I think you probably don't want to go see that person. It's not like that. It's, life is complicated,
Yeah.
relationships are complicated. It's not so black and white. And I think sometimes the most important parts of healing come from being able to confront. And confronting, again, doesn't necessarily mean saying a word.
Right.
If you're in the room with your abuser or somebody that hurt you, and that person is acting out or being disrespectful, I can leave.
You
I
can
can
leave.
say, you know what? I'm out of here. Whether I hang
Yeah.
up the phone on you, I walk out the front door. So one of the first thoughts I thought when you got that question was, well, if you're going to go visit them, make sure you drive. Like,
Right.
don't like, make
That's
sure
right.
you're the one that has the control about where you're meeting and how you're
Yep.
getting there, and have an exit strategy from the second you go.
That's right. Absolutely. And, have someone on speed dial if you need to call somebody.
Yep.
It's this kind of, I'm gonna make us sound old here, but you remember those books where it says you get to page 34. If you want to do this, you turn to page 64. If you want to do this, you turn to page 70, and each way had a different ending. It's like that. It's kind
Yeah.
of, you have to come up with a bunch of scenarios that may or may not
Yep.
happen, which I would not recommend for like a generalized anxiety disorder. But for something
Yeah.
like this, I actually would very much recommend, because it gives you your power back. It gives you the ability to set that limit and set that boundary, regardless of what the other person is doing, or not doing. And so it's important for people setting boundaries to know that they are yours and yours alone, and nobody can take them from you. And they are meant to shift, and that's okay. So I like the idea of having a plan.
And you know what? Like, when you're talking about the whole boundary thing, it's one of the things that people don't understand is that when they're in a situation where their boundaries have been violated, we often think we're the cause of that, or
Right.
we're at fault. Well, you know what? One of the best lessons I ever learned was when I realized it had nothing to do with me. And one of the
Right.
things I love about my job is when I find that I'm working with somebody who can say to me the same thing that I have said to myself. That wasn't about me. It had nothing to do with me. That is like such a liberating, freeing experience. And I think that it's something that you really don't fully understand until you're in a position where you can set those boundaries. Then you realize, well, if I'm crossing over somebody else's lines, that's the choices that I made. That has nothing to do with the other person.
That's
I
right.
can't blame you if I sit on this thing tonight and I start talking about all this stuff and then call you after and be like, why did I say all that stuff? I'm the one that decides what I share. I can't blame
Right.
you for that, right? It's up
Right.
to me to decide. And I think that that's very important when you're dealing with people with pathology and people who don't have respect for
That's
boundaries.
right. And then that's where gaslighting comes in, and that's where, we have 2 minutes, so I'll end on this. But that's where people may make you start to doubt your own reality and question your own emotions, for exactly that reason, that they make you think that you're responsible for their inappropriate boundaries, when you're not, and it actually has nothing to do with you. And when you realize that, it is a very empowering feeling across the board. So in the minute 30 we have left, I want to make sure that I show this again. I highly recommend that everybody get it. It's very, very good.
Hey.
They are case vignettes with explanations kind of following them and intertwined throughout. And it really gives I thought it gave a really good view of PTSD stories, but you handled them so delicately and with such respect that they weren't so devastating, yes, but that hit, it was not as vivid. And I think I told you that the way you wrote it really showed the respect you had for the people that you worked with. The book is called Thriving After Trauma. I'll put a link on my site for Shari. But Shari, I really want to thank you for this. It's going to throw us off in 45 minutes. I wish we could talk for another 45 hours or 45 seconds. But thank you so much for joining me. This was amazing. If anyone has any questions for Shari, you can send them to me. You can send them to her. And like I said, I will list all her information on my site so that you can go to her website and her book. So
Thank you so much. It was
so much.
so fun.
I will speak to you soon. Everybody have an awesome night. Talk to you. Bye-bye.
Bye.